Hi there. I've much appreciated both Dr. Burker and the others who've come to help me when I haven't been able to get out at all, and they've been marvellous and encouraged me. Thank you very much.
It's hard to believe it's been 10 years since Castleman Healthcare started, and I'm proud that our GP Federation has developed into a really thriving business. It's a great team built of caring, committed people, and it's been built on hard work and resilience.
This Castleman predates PCNs, but it was at that time the first time that 12 practices all got together and considered working together for the purposes of efficiencies, and began to be collaborators rather than in competition with each other, which historically was always the way practices were set up.
So I think working with Castleman has been an absolute pleasure. They're forward thinking, they're willing to try things, we're willing to review and look at what's working well, what's not working well, and adjusting and adapting. There's always been that can-do attitude that how can we do this better, and working towards that.
Very focused on what is going to be beneficial to the practices and what's going to help them, and it's great to be part of a team that really do care about what we do and how we look after our patients. I think it's a really positive team that works together to adapt, and we're very flexible and reactive to what's needed at the time.
Because it wasn't there before. We literally wrote the book and decided how we needed it to work, and having worked as a practice nurse I could see what was needed within the surgeries to support them, rather than sending all the patients along to hospital.
The diabetic nurse specialists and the respiratory nurse specialists that are employed through the Castleman organisation, the practices benefit from that. Both the patients benefit from that because they have to get expertise and advice, and those who work within the practices also have access to that to upskill themselves in those areas.
It's been an absolutely amazing service to be able to front that and to offer that.
The satisfaction of working with Castleman is you've got a body that supports you in what you're trying to deliver. And again, as Castleman have grown, our service has grown, and we have benefited from their input, their support, and funding to our team as well.
Here at Earlights, we have a great working relationship with Castleman, and we've done loads of good work over the last few years. We wouldn't be where we are without you, so a big thank you for that, and I'm really looking forward to working with you in the future.
Seamless being of providing care to the patients, whether it's in the GP practice or in the community.
So for frailty particularly, it's a real positive for the practices to be able to refer patients who would otherwise involve perhaps a GP going and visiting them. Then the frailty team, with a much more multidisciplinary, holistic approach, can go and visit that patient.
The company is growing hugely, and I think that's largely success that is due to the team. I genuinely hope and wish that Castleman has many more years of success in the future, and I'm sure that the current team will lead it well.
As we mark our 10-year anniversary and reflect on all that we have achieved, I'm really proud to support the board in continuing to build our strong foundation, strengthening our federation, enhancing GP resilience, and always keeping patient-centred care at the heart of everything we do. Thank you very much.
I'm grateful to everyone who's been part of the journey, from the teams that have worked with us over the years, and from our inaugural chair, Dr. Lionel Cartwright, who would be proud of what we've achieved today. Thank you to our amazing staff, the shareholder practices, and for all of those who've supported us along the way.
Thank you very much.